Hi, I'm Dr. Swindlehurst. I'm one of the GPs at Westmoreland Group Practice. Westmoreland Group Practice has been around for 70 years, and in that time the face of the NHS has changed considerably, as has the local area and the population. We currently have about 21,300 patients, and the population continues to grow, as I'm sure you're all aware. To try and meet this demand, there's been a lot of focus within the NHS and at practice level on the development of roles of allied health professionals. There are a lot of them now in primary care, and it can be confusing for us, let alone for the general public. In the practice, we currently have 11 GPs, 4 nurse practitioners, a physician associate. We have a paediatric mental health nurse. We have first contact practitioners, which for us are physios. We also have a clinical pharmacy team, a learning disability coordinator, a children's health coordinator. And we also have at PCN level our clinical assessment team who can carry out home visits, and the newly established neighbourhood care clinic, which is run out of Larkfield and can see certain acute presentations. All of this means that actually when you ring up and you have a problem, you may not need to see a GP. And this is a big change from 25, 30 years ago when you always had to see the GP. I think we need to get away from this idea that if you're not seeing a GP, you are having substandard care, because it's really just not the case. If you've got a problem with your hip, your knee, your back, you are much better off seeing an experienced physio. Similarly, if your child has mental health difficulties, you're much better off seeing a paediatric mental health nurse. I guess that leaves the question as to what you should be seeing me for. Now, generally clinicians are becoming ever more specialised, and this really leaves GPs as the last remaining sort of general physicians who can have an overview of everything. So really we need to be seeing the patients with complicated medical presentations, complex medical needs, or maybe people who have got a number of medical problems and they need a sort of an overarching review of everything and then a management plan. As we sort of move forward with the NHS into the future, there's going to be more and more of these roles developing in primary care, and it may also be that services become more centralised and you're actually seen off-site at a different location. This is something that we really should embrace because it is going to improve access for all.